Welcome, everyone, to a comprehensive look at conjunctival papilloma. This benign growth on the conjunctiva, the clear membrane covering the white part of your eye and the inner surface of your eyelids, can be a source of concern and discomfort. In this video, we'll delve into the depths of conjunctival papilloma, exploring its causes, symptoms, diagnosis, treatment, and much more. Join us as we uncover everything you need to know about this common eye condition. The primary culprit behind conjunctival papilloma is the human papillomavirus, or HPV. Specifically, low-risk HPV types, such as HPV-6, HPV-11, are most frequently associated with these growths. HPV is a common virus transmitted through direct contact, and in the case of conjunctival papilloma, it's believed to spread through contact with contaminated surfaces or through autoinoculation, meaning spreading the virus from one part of the body to the eye. Let's understand the inner workings of how these papillomas form. HPV infects the basal cells of the conjunctival epithelium, the outermost layer of the conjunctiva. Once inside these cells, the viral DNA hijacks the cellular machinery, forcing the cells to replicate uncontrollably. This abnormal proliferation of cells leads to the characteristic wart-like or cauliflower-like appearance of conjunctival papillomas. The virus essentially creates a microscopic factory within the conjunctival cells, churning out more virus and more infected cells, resulting in the growth of the papilloma. Conjunctival papilloma is a relatively common ocular surface lesion. While precise prevalence data varies, it tends to affect individuals of all ages, but is more frequently seen in children and young adults. Certain populations may be at higher risk, including those with compromised immune systems, such as individuals with HIV or those taking immunosuppressant medications. A history of HPV infection elsewhere on the body also increases the likelihood of developing conjunctival papillomas. The signs and symptoms of conjunctival papilloma can vary depending on the size, location, and number of lesions. Many individuals may notice a small, raised bump or growth on the conjunctiva. This growth may be pink, red, or flesh-colored and can sometimes be accompanied by mild irritation, redness, and a foreign body sensation. In some cases, especially if the papilloma is large or located near the cornea, it can cause blurred vision or discomfort. Itching and excessive tearing may also occur. It's important to note that some individuals may have papillomas without experiencing any noticeable symptoms, particularly in the early stages. Diagnosing conjunctival papilloma typically involves a thorough eye examination by an ophthalmologist. Using a slit lamp microscope, the doctor can carefully examine the conjunctiva and assess the characteristics of the lesion. In many cases, the clinical appearance is sufficient for diagnosis. However, to confirm the diagnosis and rule out other conditions, a biopsy may be performed. During a biopsy, a small tissue sample is taken from the papilloma and sent to a laboratory for pathological analysis. This analysis can identify the presence of HPV and confirm the diagnosis of conjunctival papilloma. Advanced techniques such as PCR can also be employed to identify the specific HPV subtype. While conjunctival papillomas can present with variations in size, shape, and location, they are generally classified based on their clinical appearance and the type of HPV involved. Some papillomas may appear as solitary, pedunculated lesions, meaning they are attached to the conjunctiva by a stalk. Others may present as multiple, sessile lesions, meaning they have a broad base and are directly attached to the conjunctiva. These can be further classified into subtypes such as squamous papilloma, which is the most common, and inverted papilloma, which is less frequent. The classification can help guide treatment decisions and predict the likelihood of recurrence. Treatment for conjunctival papilloma aims to remove the lesion and prevent recurrence. Several treatment options are available, and the best approach depends on the size, number, and location of the papillomas. Surgical excision, or cutting out the growth, is a common method, especially for larger lesions. Cryotherapy, which involves freezing the papilloma with liquid nitrogen, is another effective option. Topical medications, such as interferon alpha-2b, can also be used to treat smaller or multiple lesions. In some cases, particularly with recurrent papillomas, intralesional injections of interferon or cidofovir may be considered. It's crucial to follow the ophthalmologist's instructions carefully and attend all follow-up appointments to ensure complete removal and prevent recurrence. Preventing conjunctival papilloma primarily involves minimizing exposure to HPV. Practicing good hygiene, such as frequent hand washing, can help reduce the risk of spreading the virus. Avoiding touching your eyes, especially after contact with potentially contaminated surfaces, is also important. If you have HPV infection elsewhere on your body, take precautions to prevent autoinoculation. For instance, avoid touching your eyes after touching areas with warts. While there is no specific vaccine to prevent conjunctival papilloma, the HPV vaccine can protect against certain HPV types that are associated with other cancers and genital warts. making it a valuable tool for overall HPV prevention. The prognosis for conjunctival papilloma is generally good. In most cases, the papillomas can be successfully removed with treatment, and vision is not significantly affected. However, recurrence is possible, especially if the underlying HPV infection is not fully eradicated. Regular follow-up appointments with an ophthalmologist are essential to monitor for recurrence and receive prompt treatment if necessary. Recent research is exploring novel therapeutic approaches such as targeted antiviral therapies and immunomodulatory agents to improve treatment outcomes and reduce the risk of recurrence. Nanotechnology-based drug delivery systems are also being investigated to enhance the efficacy of topical medications. These advances hold promise for providing more effective and less invasive treatments for conjunctival papilloma in the future.